Hi YouTube. I know it's been a month, I think, since my last video, but I kind of got in a slump around Christmas, and not because I haven't lost weight, just because of the holidays and other things that bring you down around the holidays, I guess. I'll try not to say so much, but I have lost a total of 59 pounds, and I don't know what that in kilos is, but I do weigh myself in kilos only because when the doctor calls me, he asks me how much I weigh, and instead of me converting it back and forth. So I started around 120 kilos. That was my pre-op. I went into the hospital at 113 kilos, and now I weigh 97 kilos, which is about 213 pounds. So even though I'm in Wonderland in kilos, I want to be in Wonderland in pounds too, because I still have the imperial mindset that once I get into the 100 pounds, I'll mentally feel better, because I've grown up with imperial weights and not metric all my life. So I'm just gonna talk about a lot of things. I'm 47 years old, and I had a lot of terrible things that happened during my life, and so having an eating disorder is, I'm not going to say better than having a drug disorder, or worse than having a drug disorder, or even alcoholism or anything like that. I think that they're all combined together as an addiction. So I have an excuse me, I don't have an alcohol addiction. I have an eating disorder. Yes, I have drank in excessive when I was younger, and I have done drugs when I was younger, and those things passed. But the only thing that didn't was food, because it's legal, and since it's legal, it was my go-to, it was my friend. And just like everybody that has an eating disorder finds that food becomes your best friend, and it's really hard to lose that best friend and not have it all the time. You eat when you celebrate your birthday, you eat when you're sad, you eat when you go out with friends, and it's hard to walk away from that. And now, I mean, I can eat whatever I want to. I try to keep my protein really high, because I am losing a lot of hair, not that you can tell, but I mean, my hair is really, really thick. And I usually, well, I used to use thinning shears to thin my hair out. Well, now I just have to wash it, and, and loads of hair come out. I haven't seen any bald spots yet in my hair. I mean, if I start seeing bald spots, I'll probably end up shaving it, or as my friend Renee says, get a Chelsea, and then I'll have, like, some really long bangs, and then shave the rest of my hair. Maybe I'll, keep some in the back too, but I'll shave the majority of my hair. Or either I will undercut this and leave the rest. But anyways, that's for another day. And, I cut about 4 to 6 inches off of my hair, even though it's still pretty long. I still cut about that much off of my hair, because it was just damaged. And since I was losing so much hair anyways, I figured, what the heck, if I cut 4 to 6 inches off this time, and I have to cut off, this much more next time, at least I'll gradually go into either short or Who cares? I shave my hair. I don't care. I'll wear a wig, whatever. I don't really care. It'll grow back. But being almost 3 months out, I'll be 3 months out January 23rd. And hopefully by that time I'm in Wonderland in pounds. I have another friend, Lola, and I'm sure that down below you'll see that I commented or liked, or even on the other sidebar you'll see that she's one of my suggested subscribers, and she's really good. But she just recently had surgery, so we have a lot to talk about. Even though I'm 2 months, almost 3 months out, I still remember, you know, having surgery, and still remember like the first time I had gas and the first time I pooped, which was so exciting to me. I called my husband, I was like, I pooped, you know, like it's a big deal. But it is a big deal because then you know everything's working okay. So it is, you know, it's the first time you've done this after you've had surgery. So it's really funny, you know, and we chat back and forth all the time and we laugh about things. But I don't really, I mean, I didn't really have pain because of the surgery. My pain was more because I had a drain in. I had complications during surgery, and because I have Ehlers-Danlos syndrome, which is a connective tissue disorder, and I'm sure I've said this in other videos, but because of that, they were unable to suture my stomach, and it took my 45-minute operation 2 hours and 2 surgeons to get me stitched back up and get me, you know, put back together. And I don't have any regrets. I mean, I know there were complications, but I don't have any regrets, and I'm happier. I can move more. I have less pain. And for a long time I was in that stubborn, you know, just because I'm fat, you know, everybody thinks that that's your problem. Well, some of it is, not all of it. I have other issues that didn't get solved yet because of surgery or losing weight. Maybe they will pass in the future and maybe they won't, but we'll just see. Since surgery, I haven't had to have any diabetes medicine. I was taking injections as well as pills, and I haven't had any of that since surgery. So I'm grateful for that. My medication list has decreased a lot. I was taking so many pills coming from America, and you know, I mean, they just give you a pill for everything, and then if you have a side effect they give you another pill, and you know, it's just a horrible pill cycle. But being in Sweden, since I was on those medications, they put me back, you know, on what I was taking. And even though I had to make some tweaks here and there because they didn't have that specific medicine in Sweden that they do in America, it still worked out, and I'm still, you know, getting less medication now because of, you know, losing weight. So I don't recommend surgery for everybody. I think that it's your personal choice to do whatever you want. And if you think that it's the last resort and you can't do anything else, then go for it. I mean, you only have your life to live. You don't have to worry about what people say or what people, who cares what they think? It's your life. And if it makes your life better, if it makes your quality of life better, then do it. I posted previously that as soon as I said that I was getting surgery, I started getting emails about diets. I mean, do you think that after 47 years in yo-yo dieting that I don't know about these secret diets? Yeah, I know about them, but they didn't help. And even though I lost the weight, I would continue to go back to where I was. So it really didn't help me. So surgery has definitely been my lifesaver. It might not be yours, so I don't know. I don't know how long I have to make a video, so I'm going to stop now, and then I'm going to make a part 2.